Hello, this is Dr. A, and for this Basics of Chemistry video, we're going to look at glucose in diabetes. So glucose is one of the most frequently requested tests in the chemistry department of the lab. It is often referred to as a blood sugar test. It is most often used in the diagnosis and monitoring of diabetes mellitus, which is a sugar diabetes, and it is also useful in evaluating disorders of carbohydrate metabolism, acidosis, especially ketoacidosis, which is a complication of type 1 diabetes, coma, which can be a complication of any type of diabetes, dehydration, another complication of diabetes too, hypoglycemia, that can happen on its own or can be a complication of diabetes, and the workup of a patient that appears to be alcoholic because the signs and symptoms of hypoglycemia mimic those of being drunk. So that could be a clue that maybe they're not intoxicated, maybe they simply have a low blood sugar. So glucose is the primary source of energy for most of the body's cells, so maintaining an appropriate glucose level is really important. Body cells can burn fatty acids as fuel, but they will only do so if glucose is not available. So glucose is going to be the primary fuel that the body burns for metabolism. A variety of hormones are involved in the regulation of blood glucose levels, particularly the pancreatic hormones insulin, glucagon, and somatostatin. Insulin is going to be secreted when blood glucose is high, and its job is to get it inside the cells and to get excess glucose stored as glycogen or stored as fat. And then glucagon will kick in when blood glucose levels are low and cause the release of the stored form of glucose as glycogen to release those, break them down and release too much glucose into bloodstream to bring blood glucose levels back up. And somatostatin is related to growth hormone and also affects and regulates blood glucose levels. Adrenal, pituitary, and thyroid hormones can also play a role in the regulatory process. This has to do, for example, in the adrenal gland, which controls stress response. The stress response can cause blood sugar to increase all on its own, and this is simply so that the body has extra resources available to fight off the stress that is being perceived. Thyroid hormones, because they dictate your metabolism and how fast or slow your metabolism is, then it will also dictate how much glucose an average body cell might burn and how much ATP they produce. The normal range for a fasting serum glucose is between 70 and 100 or 110. It depends on the lab, in milligrams per deciliter. For sure, if a patient's glucose is between 70 and 100, that is definitely considered healthy. Once blood glucoses are above 100, they could be suggestive of prediabetes or diabetes if they are above 126 fasting. The serum glucose level will increase rapidly after a carbohydrate-rich meal, but should return back to normal levels within an hour and a half to 2 hours after eating, and those are considered postprandial levels, and we'll come back to that here in a minute. Hypoglycemia is low blood glucose levels. It is defined as a blood glucose level less than 50 milligrams per deciliter. And symptoms of mild hypoglycemia include sweating, trembling, shaking, rapid heartbeats, heavy breathing, difficulty concentrating, even cold sweats. An individual is usually able to self-treat the symptoms if they recognize that as being symptoms of low blood sugar. And these symptoms will usually resolve after some carbohydrates are consumed. So those could be something like a fruit juice, some milk, some hard candy. You can even put sugar in water and mix it and drink it to bring an individual's blood sugar back up. In cases of severe hypoglycemia, however, the patient cannot self-treat because it causes such mental confusion that they don't know what's going on, It can even cause them to be unconscious, and in that case, emergency medical treatment is going to be required to raise the blood glucose level, ideally by starting an IV and infusing some glucose straight into the veins. There are also glucose pastes that can be applied inside of a cheek, and they would, the membranes inside the mouth are very rich in blood vessels, and so the glucose can actually cross straight into the bloodstream that way. And that's a way to raise blood glucose levels if an IV can be obtained easily or quickly. Hyperglycemia. High blood glucose levels are indicative of diabetes. It is defined as a fasting blood glucose level that is above 126 milligrams per deciliter, or a random blood glucose that is above 200 milligrams per deciliter. There are 4 clinical cases of diabetes. There is type 1, type 2, gestational, and other. We're going to look at each one of those. Let's start with type 1 diabetes. It is also known as insulin-dependent diabetes or juvenile diabetes because it is usually diagnosed in children and young adults. There is a total lack of insulin, so that is why it is insulin-dependent. These people need to have insulin to be able to live. And so glucose cannot enter into the cells without that insulin. And so it has to be supplied externally because patients that have type 1 diabetes have stopped producing insulin. And this is usually due to the destruction of the beta cells in the pancreas that produce insulin. You will see increased lipolysis, which is the breakdown of fat from adipose tissue to supply energy. And that is going to result in increased concentration of ketone bodies, which can lead to ketoacidosis. And this will happen, this lipolysis will happen in the absence of insulin. So with no insulin, glucose cannot enter into the cells. If glucose cannot enter into the cells, then the cells have to produce ATP using fatty acids and burning fat as fuel, and that produces ketones and ketone bodies. And as that process happens, ketone bodies are part of that process of making ATP from fat, and if too much of them accumulate, then the blood gets really acidic, and that can become life-threatening. The remedy obviously is to supply them with insulin so that the insulin can start getting the glucose into the cells, and the cells can start burning glucose to make ATP. These patients typically will show weight loss because of the lack of insulin. And so insulin is a storage hormone. Insulin is a hormone that will make somebody gain weight, and they don't have any, they don't produce any, and so they tend to lose weight. Now, even though type 1 diabetes is juvenile diabetes and generally happens in children and young adults, it is possible for adults to get type 1 diabetes. Type 2 diabetes is also known as non-insulin dependent or adult onset diabetes because it occurs later in life with a gradual onset, usually after 40 years of age, and it is related to obesity and lifestyle for sure. So a typical standard American diet can definitely lead to type 2 diabetes and obesity. Sadly, we see children and teenagers with type 2 diabetes now, so because of really poor diet, heavily processed foods, lots of sugar, lots of sodas, and so that leads to type 2 diabetes, which again used to not be seen until after the age of 40 or even 60. This type of diabetes is associated with the development of atherosclerosis, with an increased risk of coronary artery disease and stroke. It is diet and lifestyle related with insulin resistance, meaning there's even excess of insulin in the bloodstream, but the receptors on the cells are not responding to insulin, and so it's not having enough of the effect that it needs to have, and a lot of the sugar stays behind in the bloodstream and doesn't actually enter the cells. Enough of the glucose enters the cell that it will suppress the lipolysis and the burning of fat as fuel, and so you generally don't see ketone bodies with type 2 diabetes, and so ketoacidosis is much less likely to occur. Gestational diabetes is a glucose intolerance that is first recognized during pregnancy, and this is due to the metabolic and hormonal changes that are experienced during pregnancy, and those contribute to this form of diabetes. Most women can return to normal after childbirth, although studies are showing that if a female has gestational diabetes, she will be way more likely to get type 2 diabetes in the years following that pregnancy. Other types of diabetes are due to various other causes, things such as a genetic defect in that beta cell function. The beta cells are the ones that produce insulin, or genetic defect in insulin action. There are also diseases of the exocrine pancreas, such as cystic fibrosis, that can affect the endocrine portion of the pancreas, or insulin secreting and glucagon secreting portion of the pancreas. And then drug or chemically induced, so an example of that would be glucocorticosteroids. If a patient is on treatment for those, especially long term, that can actually raise blood glucose level simply because they are seen in the body as cortisol, and cortisol, when it is elevated, raises blood sugar levels. So there you go. It's a drug-induced type of diabetes. Removed a drug treatment and it goes away. So let's talk about the types of blood samples that can be used for glucose testing. First and foremost and most accurate is the fasting glucose. So the patient cannot have any food or drink for 8 to 12 hours, including coffee, tea, or other caffeinated drinks. They should not take any drugs or medications that could affect their blood glucose level. So nothing to eat or drink overnight at the very least, and come in first thing in the morning and get the blood drawn. This type of specimen yields the least variable results than any of the other specimens and the most accurate. So this is the preferred specimen if it can be obtained. Then there is the 2-hour postprandial glucose. That is a measurement of glucose in a specimen collected 2 hours after a meal or after a measured amount of glucose has been given to the patient. It can be used to monitor glucose control or to screen for abnormalities. It is usually, the timing is really important. So usually what happens is in somebody that has normal glucose control, within 2 hours after a meal, the blood glucose should be back to normal. Everybody will have a peak somewhere around 60 to 90 minutes. So that's okay, that's to be expected. But unless you're diabetic, at 2 hours after a meal, that blood sugar should be back to normal. To random glucose, the results are more variable than those obtained with fasting specimens. They are not often used diagnostically. Glucose level can be markedly elevated in uncontrolled insulin-dependent diabetes. If a patient presents to the ER with signs and symptoms and with problems in their run of blood glucose, it will likely be a random blood glucose level. And in those cases, for example, if the blood glucose is above 200, then that would be diagnostic or at least highly, highly suggestive of diabetes. The glucose tolerance test, which is the GTT or the OGTT, it is used to assess patients that have signs and symptoms of diabetes mellitus, but whose fasting blood sugar is normal, or whose fasting blood sugar suggests prediabetes, meaning it is above 100 but not above 126. So it's in that in-between. It's not normal, but it's not in diabetic range. That's the prediabetes range. It is also the typical test that is used to screen for gestational diabetes. What this involves is a collection of a fasting blood and urine specimen, which will both be tested for glucose, followed by the administration of a defined carbohydrate load. Usually it's really, really sweet drink that you have to drink pretty quickly. And then blood and urine specimens are collected again at half hour and then at hourly intervals thereafter for a defined period of time, which could be 2 hours or 3 hours. I've rarely seen them do more than 3 hours. And some labs don't do the urines, they just do the blood. Anyway, so this is really predominantly used to screen for gestational diabetes. It is rarely used to screen for regular diabetes. We've pretty much gone to the A1c, which I'm going to cover here in a little bit for that. So how is glucose measured? The most common quantitative methods for determining glucose levels use two enzymes, either glucose oxidase or hexokinase. So those are two different methods. And these are the methods that are used on your automated chemistry analyzers. So if the blood sample is sent to the lab, they will use one of those two methods. Of course, you can also do point of care or self-monitoring tests. These are often referred to as an AccuCheck, which is a brand, or finger stick glucose, and they use capillary whole blood obtained from a finger stick. The newer monitors can use blood from alternate sites such as arms and thighs, and even newest technology can use an implantable device that's usually located on an arm. It is in place for 2 weeks, and it checks the glucose consistently or constantly and sends the information to a device such as a smartphone on an app, and so a person could just open the app and see at any point in time what their blood glucose is. And nurses rely on these quick results to determine insulin requirements for their patients. These testing can be done at bedside, and you get results just within seconds. The patients can also use these instruments to monitor the glucose levels at home and to manage their diabetes. The glycosylated hemoglobin A1c, and so it's glycosylated hemoglobin or hemoglobin A1c, one or the other. So what is that? What it is normal hemoglobin who's had sugar stuck to it. And so sugar is sticky, glucose is sticky, and so it sticks to protein, and hemoglobin is a protein. It sticks to other things other than protein. So, other than hemoglobin, it sticks to other proteins like albumin also, but we have chosen to measure it in hemoglobin because hemoglobin hangs around for a while. The average red cell lives 120 days. So, measuring this hemoglobin A1c reflects the average glucose concentration over the prior 6 to 8 weeks. Normal range is going to be 4 to 6%. So that would be 4 to 6% of the hemoglobin is glycosylated or has had sugar stuck on it. The more sugar is available in the blood, meaning the higher the blood glucose is on an average day, the more hemoglobin is going to be glycosylated, and so the higher that percentage is going to be. And typically, we now say any levels of A1c above 6%, we think diabetes. Okay. It does provide a more accurate measure of long-term control, and it is very useful in monitoring effectiveness of therapy. Are they on the right type of drug regimen, and are they compliant with their drug regimen, with their lifestyle changes, etc. The ideal of the glycosylated hemoglobin is the results are not affected by daily fluctuations, and the patient does not have to be fasting. So this is something that can be done at a regular doctor's appointment, follow-up care from a diabetic patient. The fructosamine, the normal range is less than 285 micromoles per liter, and the results correlate with glucose control over 2 to 3 weeks. So it is similar to the A1c. So it's fructose. Fructose is a sugar that is stuck on an amine, which is part of amino acids, which is protein. So you can see this, it's related. And fructose is the other half of sucrose. So table sugar is sucrose. It's half fructose, half glucose. The glucose part we can use and metabolize and use for energy right away. The fructose, the liver has to handle it and modify it so that it can be used for energy. And so fructose is absorbed and floats around in our blood and can also tag on to proteins. And the fructosamine test, the results correlate with glucose control only over 2 to 3 weeks. So the advantage is you could pick up on deteriorating glycemic control earlier than in the hemoglobin A1c. The fructosamine is also often used in cases where there is a turnover of hemoglobin, such as sickle cell patients. And so, because their hemoglobin doesn't last as long as a normal patient. And so in those, if you had a sickle cell patient that was also diabetic, then you might consider using a fructosamine test to monitor them. And then last, we have the microalbumin. So the presence of microalbumin is an indicator of glomerular damage and is predictive of diabetic nephropathy, and so, which is kidney damage in a diabetic patient. We want to limit kidney damage in diabetic patients. We want to try to save kidney function for as long as possible. And so this is a pretty typical screening test that is done on diabetic patients. So it is a semi-quantitative microalbumin to creatinine ratio that is done on a random spot urine sample. If the screening results are indicative of microalbuminuria, then a 24-hour urine collection for a quantitative microalbumin should be done, and tests should be repeated in 3 to 6 months because there's a variability that exists in the excretion of albumin, and if a patient exhibits 2 or 3 positive screening tests for microalbuminuria, then that would confirm the diagnosis that they are starting to suffer some glomerular damage and they are having some diabetic nephropathy, and that's going to have to be managed. So there you go. That wraps up our glucose and diabetes video. So thank you so much.